The subcommittee will come to order, and the chair recognizes himself for an opening statement. Thank you all for being here. In today's markup, we will consider 17 bills that advance the goal of protecting and promoting greater patient access to quality care, making our health care system more transparent for patients and their families, and driving more competition and choice in our healthcare system. These bills represent key priorities of the American people, and I look forward to advancing these bills. Our shared bipartisan goal has resulted in productive bipartisan discussions leading up to this markup. Many of the bills we are considering are the product of robust bipartisan work with the common goal of helping patients. The subcommittee undertook a rigorous process. We held hearings. We heard from impacted stakeholders, including relevant government agencies, and we incorporated feedback shared with subcommittee members and staff from both sides of the aisle over the course of the past several weeks. We made improvements to ensure these proposals ultimately have the greatest impact on patients. I'm proud of the work we have accomplished to get us to this point. These bills represent key priorities of the American people, and I look forward to advancing these bills before us to the full committee. We have heard countless stories about how the complexity and opacity of the healthcare system and how that impacts patients, employers, and even healthcare providers. Today, we will consider legislation to increase transparency into the prices that hospitals, laboratories, and insurance companies charge patients and employers. The legislation would also increase transparency in the prescription drug market and the vertical integration that has taken place in our healthcare system. These solutions will bring much needed transparency to patients and employers. As policymakers, we are strengthening our healthcare system and federal programs to ensure patients are getting the greatest value. The legislation before us today also reauthorized numerous programs designed to bolster patient access to care, particularly for those most in need. We're taking up legislation to protect access to care in vulnerable communities by eliminating looming cuts to disproportionate share hospitals and continuing funding for the Community Health Center program, both of which serve thousands of patients in each of our districts. One of the problems that I hear about most frequently back home are the workforce challenges across the healthcare system. Legislation before us today would serve as one step to addressing some of these challenges, especially in rural communities, by extending funding for the Community Health Center Fund, the Teaching Health Center's Graduate Medical Education Program, and the National Healthcare Service Corps. We're also promoting access to care for vulnerable Americans who need life-saving, one-of-a-kind treatments. My bill, the Medicaid Value-Based Agreements for Patients Act, or the MVP Act, will provide access to the most innovative cures for Medicaid patients living with otherwise incurable or untreatable life-threatening conditions. We're talking about patients dealing with diseases such as sickle cell, Duchenne muscular dystrophy, and debilitating bleeding disorders. I want to personally thank Representative Eshoo for her leadership to take on this bill with me that will ultimately save lives and promote long-term savings for state Medicaid programs. Our hearings have shown us how lower costs and higher quality of care can be achieved through policies that promote competition and choice. One of these policies will ensure seniors aren't paying more for drugs depending on where the drug is administered. Seniors shouldn't pay more for the same drug and same level of care in one setting than another, and this policy is a first step towards broader reform. Additionally, patients waiting for a transplant have suffered from lack of competition within the organ procurement transplant network. These critically ill patients shouldn't be left waiting longer for a life-saving transplant because of an outdated system, and today we'll vote on legislation to increase competition and improve the effectiveness of this critical service for some of our most vulnerable patients. In closing, I want to express my gratitude for my colleagues on both sides of the aisle for how deeply engaged everyone has been on these issues. I'd also like to thank the staff of the committee and our offices, member offices on both sides of the aisle who have worked tirelessly to get us to this point. The American people and our healthcare system will ultimately benefit from our bipartisan work and the leadership of everyone in this subcommittee. I appreciate everybody's help. I yield back and recognize